This is Cedarcrest Hospital, Abuja, a modern specialist medical center. They provide high-standard healthcare services to patients within and outside Nigeria. They began operation in 2008 as a highly specialized orthopedic facility. As the practice grew, they began incorporating other specialties, especially those that relate directly with orthopedic and trauma surgery. This became necessary as the need arose to fill gaps created by lack of local specialist services in those areas. 11 years on, Cedarcrest has now become a multi-specialist medical center with operations in Abuja and Lagos, Nigeria, covering services like obstetrics and gynecology, radiology, rheumatology, ear, nose and throat surgery, dietetics, physiotherapy, and of course, general practice. Dr. Felix Ogedegbe is the MD, CEO, and Medical Director at Cedarcrest Hospitals.
I believe we're a unique hospital because of our approach to healthcare. We believe that having worked in other parts of the world, I used to work in the UK, we believe that we can offer healthcare that is at par with what is obtainable in other parts of the world. We have brought this expertise and we've also brought the equipment that goes along with it. And we also have engaged in training and retained a lot of very trained people. So what's special about us is that we've actually been able to show that highly specialized complex healthcare, particularly in surgeries, can be obtained here, can be done, and you can get the same kind of results that you also expect to get in other clients.
Since the vision for Cedarcrest is to give Nigerians at home access to world-class healthcare, the hospital has been able to encourage some of the millions of Nigerian medical experts and specialists spread all over the world to contribute back home. Consequently, they have put together a group of well-trained, highly skilled doctors and consultants who are supported by courteous nurses, imaging and laboratory scientists, administrative and ancillary staff who strive to give patients an unforgettable experience at Cedarcrest.
At any point in time, you have emergencies, whether road traffic accident or somebody who has just lost consciousness, they come to the emergency service, they have a doctor who can attend to them.
Cedarcrest had a vision of providing world-class healthcare in a local environment. And so our push is not from the hospitals around, because we're not trying to be like any hospital here. We're trying to make sure that patients don't need to go abroad to get an international standard of care.
If a patient comes to Cedarcrest Hospital, irrespective of the problems, irrespective of the nature of investigation that the patient will go through, irrespective of the nature of treatment that the patient would demand, except in extreme cases, we want to be able to give the patient the maximum benefit of not having to go here and there.
The hospital also has a strong cardiology unit where evaluation and intervention surgeries are carried out, reducing the need for people to have to go abroad for medical attention.
In the cardiology unit, what we do is to evaluate people, talk to people, see their cardiac risk, take their history, and then intervene. So prevention is better than cure, so we like to prevent these diseases than getting to cure them, because Nigerians, we don't have that culture yet to donate organs. So if somebody has a heart failure or a person has probably end-stage heart disease, in most cases they die. So this is an echo machine, one of the devices we use just to look at the heart. It just shows the structure of the heart, the function of the heart, so we can see if you have a valve problem, we see if you have a hole in the heart, we see if your heart is functioning properly, we see if you have hypertension, if it's just sudden, or if it has gone on for long. So with technology, we're able to do a lot of things. In this hospital, we're proud to have done some pacemakers, so patients that suddenly have problems with their heart, it's not beating regularly or beating as much as it should be, and they are weak or almost dying, we put a pacemaker in them, and then within hours they jump up and they are doing fine. So we do that. And we hope in the long run we'll be doing heart surgeries, open heart surgery. So it's very sad when you see kids with problems, no diagnosis, and then people going to India when we can do a lot of these things here.
Given the quality of care available at Cedarcrest Hospitals, is their service affordable?
Well, for the kind of care that we give, I would say that we're affordable, because it's interesting that you actually will not compare the cost of care in Cedarcrest with the cost of care in, say, most government hospitals, but you rather compare the cost of care here with what you find in other parts of the world. And for the kind of procedures that we do, we are extremely affordable.
In all of these, Dr. Ogedegbe says the impact of the Bank of Industry's intervention is immeasurable and encourages other players in the healthcare sector to take advantage of BOI's support.
The Bank of Industry is a bank that has been set up to fund equipment and things like that for industry people like us. And I'm glad that you've had a very good interest in the healthcare industry. Some time ago, we approached the Bank of Industry for a loan to buy new equipment, and we were very, very happy that this loan was approved. This specialized equipment that would help us to extend again the reach, to extend the kind of procedures that we're able to do, like the bone densitometer and some other equipment, are things that are not commonly used in this environment. So we're happy that we have this loan, and we have this support, this wonderful support from the Bank of Industry, and we will see that by utilizing the proceeds of this loan, there will be less reason again for people to want to go abroad to look for any form of care. I think from a banking point of view and from access to funds, the point of view, the BOI intervention is a very good one. The interest rates are low. I'm not in a position to know how much has been invested in the overall health sector, but I think it's something that I would encourage that most of the healthcare providers try to assess, because interest rate is low and the documentation is quite straightforward and low. Once the intentions are clear and the business plan is clear, I think that the Bank of Industry gets very interested. So for me, it's a very interesting proposition to have the Bank of Industry expand the way it funds healthcare right now, because I think that this will help us to further push the availability of healthcare services in this country.